like I do find myself like the rage being one of the things that I have a harder time controlling, even though I'm trying to, I'm trying to medicate with my own, formulation of menopausal hormonal therapy. I'm
Yeah.
trying to give myself, the hormones, I'm in the back of their head, or I'm considering like after a couple months of this, am I going to figure out if I need an SSRI? Am I going to talk to someone about it? Am I going to have time for cognitive behavioral therapy? These are things
Right.
I don't have time for. So
Yeah.
just like it just adds another to-do list to women. So sometimes when people say like, "Oh, just send her to therapy," and I'm just like, she has a lot on her list already, and I'm going to send
Thank
her to
you.
another thing.
Welcome to Meno with Jacqueline Buckingham, the authority on menopause, perimenopause, and wherever you are on the pause spectrum. I'm Jacqueline Buckingham, founder of Meno, and firm believer that menopause is status, not a sentence. If you're here, something in your body or your life is asking for your attention, and you're not meant to navigate that alone. In our first 2 seasons, we started this conversation, won an Anthem Award, and brought you the leading experts before they were on Oprah. Now we're raising the standard. Each week, I bring you the verified providers, menopause specialists, and authorities you need to understand what's happening in your body and what to do next. From the gold standard in HRT and the little pink pill for sexual desire, to the conversations no one else is having about relationships, identity, and mental health. This is the full picture of your health, because this stage of your life is not just about symptoms. This is about how you live, how you feel, and how to embrace it all, because you have arrived. Pausing or not, start here. This is Meno with Jacqueline Buckingham. Joining me today is the one and only Dr. Sameena Rahman, though you might know her as Gyno Girl. As a board-certified OBGYN and sexual medicine expert, Dr. Sameena is on a mission to blow up the taboos that keep women from advocating for their own health. From navigating menopause to breaking through cultural shame, she's here to give us the raw evidence-based truth about our bodies. She's smart, she's fearless, and she's exactly the advocate we need. Here is my conversation with Dr. Sameena Rahman. Let's start with, how does your rage manifest? If you're willing to share.
Yeah, no, I mean, it's just a short fuse. I feel like it's like a short fuse. Like I used to have more patience with my children, with my parents, with my husband. And these are the people you love in your life that get most of the rage, right? It's like, and the little things start to add up over time. Like, telling your kids over and over again to put things away becomes like this thing that can break your day, which is stupid.
Yes.
You think about it, but you're like, and then you lose things because no one's putting things in the right place. And then the rage comes on, like, this is happening again. And I think it's just the whole chaos thing. The chaos thing. It's really hard to manage chaos in your life in midlife. And it's because women in midlife are managing too much. They have too much on their shoulders, right? You have kids, maybe, you have parents, maybe, you have husbands, divorces, spouses that have, not around anymore, maybe never had a spouse. Like these are things that can consume you on it, and then you throw in, and career stuff, right? People are pivoting in the midlife. People are, like I've taken on this whole educational platform, and pivoted 10 years ago into a private practice where I could really practice medicine on my own terms, right? And then I started doing more educating as a result. And now I'm doing a lot of speaking and all the things. And it's like, there's a lot you put on your plate. And then, so any little thing can set you off. And I feel like you throw into that mix of like chaos, a little bit of hormonal dysregulation, right? And it's not a little bit, it's a lot. Because, the perimenopausal roller coaster is 1 month your estrogen is sky high and you're bleeding and you have headaches and you have boob pain and all this stuff.
Yes.
And the next month you're dry as a like vaginal irritation, hot flashes, vertigo, like all the things of estrogen deficiency.
Right.
And it's really that delta from high to low that creates so much chaos in a woman's life. And that's why sometimes people get a resolution of symptoms after that, whatever, months to 10-year period of time goes away. And we have no way of predicting that, right? We can kind of say, like, how did your mom go through menopause? But a lot of people have never spoken to their mom about that. Or if they did, they're just like, I don't know, I just went through it. I just, that's just what we do as women. And so it's a generational thing where people think one thing had to happen and it just is the way it is. And so now those of us that are cognizant of what's happening with our body, it's real. And so, and it goes back to the fact that we have estrogen receptors from head to toe, right? Like our brain is full of these estrogen receptors. And that's why there's so much mood and cognitive distress in perimenopause. That like, wait, I can't remember of what I was just about to say thing, or why am I crying over this, like, stupid commercial, or, the one thing that your kid said to you that you would have laughed about 2 years ago set you off into tears. You know what I'm saying? Like, it's a lot of distress, and it's just this whole, it's stress, it's lifestyle stuff. It's like, oh, my body's not the way it used to be, and like now I don't feel as good about myself. And this general feeling, and this is a study that was published last year that showed women in perimenopause had a general feeling of not feeling like themselves. And that's what a lot of my patients tell me. And that's how kind of I've been feeling navigating this. Like, you just don't feel like yourself. You're not the same, like, and even people tell you that, oh, you used to be so, boisterous, and you used to be like, full of energy, and the person we'd go to laugh. And now it's just like, and then you feel bad about yourself, right? Like, people tell you internalize it.
I mean, how are you supposed to feel when somebody says that to you? I think we also like feel alone in that, right? Oh, like it's just me. So if somebody says that to you, or if somebody says that to me, or all of a sudden I'm like, oh my God, like what happened? I'm not feeling like myself.
Right.
I don't feel like I look like myself. Right. I don't feel like that thing you said about, your kids may say, something that is usually going to make you laugh and then is like making you cry. Like,
yes.
Oh my God. I mean, it really is, I think at such it's a cellular level, right? So disconcerting.
Yes, absolutely.
And you're right. So there is that like chaos. So I wonder what it is about like the rage, right? Like how rage expresses itself, and does it satisfy anything? So if you are to, just like blow up at your husband or your, best friend or your colleague at work, like, does it satisfy anything? Is there a relief that comes from that?
One of the things that like the Menopause Society, when we talk about mood dysregulation in perimenopause, of course, like there's a role for like probably SSRIs, there's a role for hormonal therapy,
sure,
cognitive behavioral therapy, which this is like likely some form of that, right? Where you're
absolutely
trying to address it head on, by releasing this, pent up energy, or and you wonder, like when you hear people talk about the Karens of the world. Like, because they're usually like midlife women, I think. I don't.
They are. They're all midlife women,
right? Like, are they just like experiencing perimenopausal rage, and they just found an outlet to do it, which is unfortunately like based in systemic racism, right? Like, this is what's happening.
You know what? I think that's so true. I think all Karens are really. I think all Karens are just perimenopausal,
right? And they're just not getting the treatment. I mean, of course, we're all a system of what we were raised in, right? And so, like, and we know about this whole like systemic racism that exists in the world, and that we're all brought up into this. And so, unless you're aware of it, like, you're not going to address it. And so, these people are addressing it in more of a racist fashion by like calling out, unfortunately. Yeah. But it's true. I think that like it's unfortunate that. We're just not aware of our own stuff. And I feel that this is one of the biggest complaints I try to help with my own patients. But as I've entered perimenopause, it's one of the things that I have to check myself in. Like, I'm like, this is something that I don't like feeling that way,
No.
Like, sometimes I'll cry and I'll be like, why? I don't like feeling like this. This is not my essence of who I am. And when people tell you that, like, this is not who you are, it actually makes you feel worse. You're like, I know
it does.
That's not who I am, and I'm trying to figure out the best way to regulate it. And again, sometimes hormone therapy helps. Sometimes getting your sleep right, your stress reduction, the yoga, whatever you need to do to center yourself. But it's really about controlling chaos in so much of it.
Yeah, like philosophically, I think it's really interesting because on the one hand, it's trying to regulate, and I'm like, okay, great. yeah, sure. Let's, get our hormonal balance right and let's regulate so we feel more like ourselves.
Mm-hmm.
And then on the other hand, I'm like, I think we should all just let it rip. Right.
Yeah.
I mean,
And
I
it's
think we
very
should,
individual, right? Like it's
yeah. Like on the other hand, I'm like, maybe the thing that would provide some regulation, and I'm interested in this, screaming in the woods thing or smashing, right? Or smashing of
we
stuff.
need to
Like
create our own ritual, Jack.
I know, I'm right there with you. I'm totally right there with you.
Actually, when I read about it, I was like, should I go do this?
No, I'm either thinking like we all go together, like we all go, right? And honestly, I'm like, and let's make a documentary about it. Or it's like we create our own. And that would be interesting too, is to think about like, if all of a sudden, just like regulating let's just call it vaginal estrogen cream. Okay.
Mm-hmm.
So I'm putting that on 3 nights a week or whatever it is, or my testosterone cream or, whatever patch, whatever pill, whatever you're doing.
Mm-hmm.
So like, not instead of, but maybe in addition, there's like this rage ritual that we do. And I feel like if we kind of like picked from a list, right? If it was like, okay, when you're going down the highway, and it's totally safe.
Yeah.
Just, scream at the top of your lungs with your, sunroof or moonroof or whatever, window open.
It's true. I got to tell you that, in college, I remember this specifically. It was every finals week, we would have a primal scream at midnight. And it was like the stress of, I went to Duke. And so every finals week, every time there was like these really tough finals, at midnight, you would hear primal screams. And that's what it is, right? It's
that's
like this
cool.
Coming back to like, and I actually remember it being cathartic. I remember it being like, wow, that felt good. Like I just got it all out. And it was like, you could just hear the whole campus screaming.
Yeah. I think it's really powerful.
Yeah.
I think it's really powerful. You're reminding me of what I would say to my mom. I was probably around, 6 to 8 years old at the time. And when we would drive on the highway, I would say to her, can I do it now? Can I do it now? And because she'd make me like wait until we got on the highway, and then she'd roll down the windows and I could scream at the top of my lungs. And so that was fun for me. So clearly that released some kind of, maybe it's endorphins. Would that be right?
Yeah. Yeah. I mean, well, it's just, I think it is like what, the endorphins you get when you're like running, you accumulate them and then it's just like this total high. But I think it's all a matter of how our brain is working, right? With the dopamine, the neurotransmitters, the norepinephrine, things. And I think that release is, something that is probably beneficial for some patients, right? Some people like this inner peace where they're just meditating and they're trying to calm the noise down. And some people need to release the noise. They need to just like let it out and then calm. And I think it's just a matter of even like that, probably down to personalities and how you kind of like, deal with interpersonal relationships.
Yeah, so true. So true. I do feel like if we gave ourselves the permission though, to really just let it rip like that, obviously you don't want anybody getting hurt. Okay. Disclaimer. Okay. Of course. But in a way that is, safe, right? It's like, it's safe for you. It's safe for other people. But it kind of comes close to that line where you're like, oh my God, like I'm about to do this, whatever that is for you, because I think that's relative.
Right. No,
so what's something that you've thought of that you're like, ooh, should I, could I, would I?
I mean, when I was asked to comment about these rage rituals in perimenopause, I actually thought, like, is this something? Because, like, I do find myself, like, the rage being one of the things that I have a harder time controlling, even though I'm trying to, I'm trying to medicate with my own, formulation of menopausal hormonal therapy.
Yeah.
I'm trying to give myself, the hormones, I'm in the back of their head, or I'm considering, like, after a couple months of this, am I going to figure out if I need an SSRI? Am I going to talk to someone about it? Am I going to have time for cognitive behavioral therapy? These are things I don't have time for. So just like it just adds another to-do list to women. So sometimes when people say like, oh, just send her to therapy, and I'm just like, she has a lot on her list already, and I'm going to send her to another thing. But
Thank
again,
you.
that's also self-care in so many ways. So yeah, you have to kind of like try to figure out a way to balance it. But yeah, I thought about, should I just go to the woods and start like beating on a stick against
Yeah. Like I want it to feel amazing, whatever it is, right? Whether it's the
yeah,
woods or the desert or the beach. I
yeah,
think that that is something that we've lost a bit in our cultures across the world, not
well,
just in
right.
our
The
culture.
technology, right? We're just like this
Yeah.
instead of
We're
like
like
out.
this,
Yeah,
right?
yeah,
Totally.
yeah,
That's something I think that if I'm going to like dream here for a second, I'm thinking it would be amazing to have something where using technology where we could actually all come together. So let's say my group in California, your group in Chicago,
yeah,
we come together and we are doing this like monthly rage ritual.
yeah. That'd be so awesome.
I think that would be so fun because I think it would be really cathartic, not just to have the experience, but then to witness others
Yeah.
experience too.
Yeah, yeah, and how that release helps them so much. I mean, I just returned from Rio for the world meeting on sexual medicine,
Yeah.
and Rio has so much natural beauty that there was
Yeah.
a time where I just stepped back and I put my phone away and I just looked. And I
Hmm.
looked at the waves and I looked at the mountains. I mean, it's very, very similar to California in that respect. And you just feel like, this is what you need to do. You need to be in the sun, looking at stuff, and not looking at this. And you get some
Yeah.
inner peace from that. And I think
Yeah.
we've lost that with this age of technology. And I do think that the kids nowadays also have lost that. Like sometimes I'm just like, go outside. You guys need to go
Yeah.
outside. Like
Go
just get
outside.
outside, you know, because
Yeah.
that sun, that vitamin D has its own catharsis. I think.
Yeah, it's true. It is really, really true. Well, let's talk about like the regulation, really kind of getting into the perimenopause and how you regulate yourself, because a lot of it is, you may have somebody that you can work with, which is fantastic.
Mhm.
Sometimes you're working with people, maybe it's online, maybe you've gotten a product from the store. And so you're just kind of trying things out. What do you tell your patients that are going through perimenopause? How are you helping them find a solution, right? Because it's a moving target all the time. It's not like, oh,
Yeah.
hey, take 1 teaspoon of this for the rest of your life.
Right.
No. How do you do that?
Yeah, I mean, I think that's one thing they have to understand, that there's no, I guess, magic bullet. Like I prescribe hormonal therapy. I'm a big believer in it, but it's not a
Yeah.
magic bullet in that it's one aspect of a toolbox that we use, right?
Yeah.
It's one of the toolbox. So, I mean, we have to talk about diet. What are you putting in your system? Like what kind
Right.
of foods are you eating too much, foods full of inflammation and processed foods
Right.
that can make a difference in
It's
how
true.
you feel internally. And then, what is your exercise regimen? Or like for me, catharsis is really going out for a run, right? And
Yeah.
my family is well aware of the fact that like sometimes they're like, do you just want to go for a run, mama? Because maybe you'll come back in a better mood. And it's very true. I've been
Absolutely.
running since I was 10 years old. And it's just the one thing that I know, that if I can get out and do my 20-minute, 30-minute run, even if that's
Yeah.
all I have, it's enough. And it has to be outdoors because treadmill running doesn't do the same thing for me. But it is
Yeah.
one of these things that I have to do. And so I feel like, what's your exercise regimen? Are you lifting weights? Are you building muscle mass to help, prevent frailty, right? Like we don't want to be frail
Yeah.
old women.
No.
And so that's the other thing, and then stress reduction. I find that's the hardest thing for midlife women to really address
Yeah.
because of that reason. And I think that, that's what causes so much sort of damage to us on a cellular level. Like
The
that's
stress.
why when I talk about like, if you're living in chaos, I have patients like yourself. I was talking to one just yesterday who was like, I've done everything you said, but she was saying, I'm in the middle of renovations in my home and I'm not living in my house right now. And she was telling me how that I think I feel better, but I don't know because I'm living in like this situation. And it's like,
Yeah.
you can't regulate yourself and you can't reach homeostasis if you have so much chaos around you. So I
Oh
think
my
that
God.
stress regulation is really big. And then, looking at all the other factors around, do you smoke? How much alcohol are you drinking? Like other lifestyle things that we can eliminate, because I think, those at the end of the day can really put more damage to you on a cellular level.
Oh yeah.
And sleep
Yeah.
too, right? We can never, never, never not look at our sleep patterns, because I think that
No.
we know that sleep has a profound impact on our mood and how we feel about ourselves. And we also know it can impact how we gain weight, heart disease, and all of these things that lead to like increasing chronological age, really. Like
Right.
when you talk about aging and how our cells are aging. So I feel like that's one thing that we
Yeah.
don't pay enough attention to. Looking at your relationships, looking at all the things around you, and again, those patients that need menopausal hormonal therapy, they're afraid of osteoporosis and breaking a leg. They're having really bad hot flashes. They're worried about their mood stuff, all the things that might be beneficial. And we know that, the major indications for guidelines are really, prevention of osteoporosis, vasomotor symptoms, and genital urinary syndrome menopause. But we've seen other benefits that we cannot ignore as well. So
Absolutely. So like, how do we then address basically all of those things on the list without the list stressing us the F out?
It's so true. I mean, this is very true because this is why sometimes I'll see my patients pretty regularly after I first meet them. Like because I tell them we go through a lot of information and they tell me like, geez, Dr. Rahman, my vagina's so high maintenance now. You want me to do all this stuff, help core therapy, vaginal estrogen. Like I have a really high maintenance vagina. Some of them have like skin conditions. They need steroid creams, And so I'm like, you got to think of it like a whole regimen. If you're okay putting creams and washing your face and brushing your teeth, you got to just be careful with your vagina too, because it's, we know genital urinary syndrome menopause, chronic progressive condition that won't get better, right? Unless you treat it. So, but I think it's a matter of really, I think this is really what self-care is, right? When you talk about how can we preserve our humanity, prevent insanity, all the things that we want to do to really preserve our mental health. As well as our relationships, right? Because if women are often sort of like the matriarchs of their family, they're the ones that dictate a lot of what's happening, even though politically we don't see this. But in households, you can see that a lot of times it's the women that are really dictating, the mood, the family system, everything. Because they're the ones carrying the burden for the most part. And some men carry equal burden, but it's not always the case. And I think that, it's really like, okay, I got to take this time for myself, period. End of discussion. And you got to just do it. And sometimes you need that extra guidance, right? Sometimes this is where I think some people utilize like life coaches. They have counselors, they have psychologists that intervene for that cognitive behavioral therapy that can be helpful. Depending on what your underlying issues are, right? I think anxiety is huge in society right now. Like everyone's.
Yeah, it is. It absolutely is.
Climates all over the world, all the things. So.
Yeah. I mean, it really begs the question of like, how much of my anxiety is attributed to our world today and just honestly reading the newspaper for 30 seconds or turning on anything or looking at your feed or whatever it is. To opening your phone,
right? Doom
right?
Scroll, or whatever.
And how much of it is attributed to my perimenopause?
It's a perfect disharmony about what's happening, right? Both. That's why I say it's like a perfect shitstorm that happens because
really
all this stuff is happening in your life and we have all these new technologies that are great, but also like causing us to like really pay too much attention of what's happening on the phone, right? And then all of a sudden just throw in a little dash of like your hormones are going crazy. So
Exactly. Sometimes do you ever feel like, too much information? Overload, right? Like with your patient. So all of a sudden you're like, okay, you need to be doing this and this and this, right? And so it's the stuff for your skin. It's the stuff for your hair. It's everything. And then all of a sudden you're just, you don't want to do any of it.
Yes. And they tell me that all the time. They're like, man, you're telling me a lot. And I just feel like I can't even do it. And so
what do you do?
We just talk then step by step. Okay. Like right now, like a lot of people come to me for their sexual complaints, right? Or their urinary vaginal complaints. And so I'm like, let's see if you can add this first. And I never add everything at once, right? And it's because of this reason. Like, I don't say like, all right, start your testosterone, start your estrogen, start your progesterone, start your vaginal stuff. I'll address the biggest elephant in the room, which is oftentimes their sexual concerns, right? Like there are a lot of midlife women are with, new partners, like younger partners sometimes. Sometimes they're with partners that they've been with forever, but their partner has erectile dysfunction, or their female partner has, low libido too. It's like this thing. And so this is the primary reason you're seeing me. I reviewed with you all the stuff that's happening to you systemically that needs to be addressed, but let's get this head on, because this thing is what brought you to me, and this is what I can tell is bothering you the most. And sometimes everything's bothering me at the same time, but I still pick, one thing to go at first. And then I'll just have them come back, come back and see me in a month after you've tried this. And then maybe we'll start talking about this other thing.
I went back to school for lifestyle medicine and neuroscience, and my lifestyle medicine professor named Elizabeth Frades was teaching the class SMART goals, right? Specific, measurable, attainable, and then timely. I know the last one's timely, but the point of, I remember the take home for me, somebody who does want to write down every single thing on the list and then do it all right then. It's oh yeah, it is one thing at a time. That's been a difficult concept for me, as somebody who's much more of a, sit down and get it all done instead of oh, let's do a little bit today and a little bit tomorrow. But you have to adopt that philosophy, that headspace, if you're going to make it through perimenopause, because you can't just be let me slather on the entire thing of cream and now I don't have to do anything else for the rest of the year.
And I like to make it realistic. This is something that I've had to have a realistic conversation with myself about, that I'm never going to be that 20-year-old self again. And nor do I want to, right? The 20s was a different period of time too. It wasn't, even though it was great in so many ways, there was a lot of different types of chaos, right? Different types of figure out who you were as a person. So even though I feel great as a person of who I am, and I'm comfortable in my skin in a lot of ways, it's really just okay, I have to adjust to a new normal. And that's, I think, what the hardest part is, right? It's kind of if for patients that have had pregnancies, and you see so much bounce back culture when it comes to the fourth trimester and postpartum care, right? It's bounce back, just bounce back to yourself. And you're I will never be able to hold urine the same way I did before I had my 3 kids. Okay. I've tried many things, and yes, I'll probably have a sling one day, and maybe that'll be my answer. But the reality is, it's not going to be the same. My vagina is not going to be the same. It's just not. And it's okay. I've come to accept that. And it's a new normal that you can feel empowered in, versus, the remorse of oh my God, my youth is gone and this is gone. It's really, I think that's how people refer to it as aging gracefully, or whatever the case is, right? You want to a new norm of who you are, and feel more comfortable in your skin.
Absolutely. I do think it's a matter of taking a look at the things that you are okay, accepting, and really just not doing anything about it. What's coming to mind for that is I saw Kate Winslet talking about the beauty of older skin. And she was I think wrinkles are beautiful. She's they are, it's the added expression. So she's someone who has, come out as a Hollywood actress and said I'm not trying to look like I did when I was 30.
Right.
I think it's really beautiful.
Right.
And I'm really happy that there are those people in the world. Yes. Not to say that there's anything wrong with doing the thing that you want to look like your 50-year-old self until you're 80, whatever it is, to each their own, honestly. We were kind of told in our generation, you can do it all, you can have it all.
And it's bullshit.
No.
You can't, right? Nor should you want to. It's just a lot of crap, actually.
Exactly. I had a conversation with a friend of mine yesterday who's got 4 kids. She's a lawyer. She's got a busy husband. She's got, all these things going on. And she was I'm so mad at that. Really. I'm so mad at the fact that I was told you can have it all. You can be the president of the United States and also be on the cover of Vogue and also have 6 kids and also, right. And her point was there's not a day where I feel I'm successful because I feel I'm failing in some area all the time. And I think we can take that truth that so many of us have, hey, maybe I did okay at work, but then I absolutely failed at home, or maybe I'm, failed at home. It's generally, I'm going to say that the scales are tipped to more of we're failing rather than we're killing it and feeling so successful. But I think we could take that and apply it actually to our perimenopausal efforts and go, hey, maybe if it's one thing I can feel successful at, like let's say it's your sleep and you're like, hey, I slept in today.
Yeah.
So nice job.
Yeah.
Instead of like, oh my God, I slept too much and I didn't get this done. Whatever it is, like, or maybe it's like I do the New York Times crossword puzzle, and it is like my luxury at night.
Yeah.
I love when it's just quiet.
Yeah.
Nobody's talking. I've got my earplugs in and I'm doing my crossword puzzle. And there's a part of me that feels guilty about it. But then if I'm going to apply it to basically like my perimenopausal protocol, I'm going to go, you know what that does for your stress? Like a lot.
Yeah. Not only that, cognitive fitness. When you talk about trying to preserve your cognition and dementia prevention, that's huge.
Yeah.
Like, and we have to, and that's one thing that I always talk to my patients about, because that's a big, if you've ever been around patients with dementia or have family members with dementia, it's very heartbreaking, actually, and it affects people around you more than that. So I'm a big proponent of what can we do to improve our cognitive fitness. And so that's why I'm always like, okay, you got to keep your social interactions. You got to exercise. You got to have that, try to Mediterranean diet. You got to, do all the things in your lifestyle, that stress reduction, everything that can really benefit you ultimately. By the way, speaking of Kate Winslet, she came out with the fact that she's been on testosterone for hypoactive sexual desire disorder. So I thought that was really good to bring that to the center of her discussion.
And I think more people need to know about that term, HSDD. We first talked about on the show with Cindy Eckert, who developed the female Viagra, Addie. And how do you bring it up with your patients? How do you talk about it? Do you wait for them to talk about it, or do you kind of use that? You do. You just jump right in.
Yeah, I mean, I talk, because I'm a sexual medicine, expert. This is the thing that I love to talk about with them.
Yeah.
This is the thing that they don't ever get at other places.
Right.
So I just ask them straight up. I'm like, a lot of, women suffer from, low desire or sexual concerns in midlife, or sometimes I'll tell them if younger patients, when they're on the birth control pill, the same thing. Like, this is something that is very common. It's one of the most common complaints. 40% or more, depending on the study that you read, of women experience low libido with bother, with frustration. This is something that impacts their quality of life and sometimes how they feel about themselves. Is this something you feel? And then they're like, really, this is something more common. Well, I don't have much. Well, actually, yeah, I do feel bothered by it. And then we have to address if there's like a sexual pain issue that we have to address first, like, 'cause obviously if you're having pain with sex, nobody wants to do that. Like if it feels like, sandpaper, sex or whatever, whatever, however patients describe it, needles, knives, everything in the vagina, you're not going to want to do it. So once we resolve those issues, then, it's like, okay, let's talk about this, and, trying to explain to them how the brain works and how our brain is our biggest sexual organ. And, there's things that put us into an excitation or an inhibition mode when it comes to sex. And, you have testosterone, you have oxytocin, you have norepinephrine, you have dopamine that all act on our brain to, get us excited about sex, that cause us to, feel the desire, feel the arousal, feel the orgasm. And then you have things that can inhibit us from a biologic perspective, right? There's psychosocial stuff happening too, but from a biologic perspective, there's all the things around, like prolactin and opioids or serotonin, which is, commonly a part of the issue that happens for people that are on antidepressants, is that they're getting serotonin and they lose their sex drive, they can't orgasm. So I think, addressing what medications they're on, because I'm all about like the biopsychosocial approach, but I'm the bio, right? I'm the one that's going to help you through the bio. And then psychosocial stuff, we have sex therapists, we have, psychologists and other things that can approach. Like if a person's always anxious or always depressed, a key feature of depression is anhedonia, the lack of desire to do anything. So if you have no desire to do anything, that includes no desire to have sex. So sometimes patients who get treated for depression actually then start to have a libido again, right? And other times it just gets worse because of the antidepressants. So I address this with them, and then I tell them their options. Like for midlife women, we know, and we call that hypoactive sexual desire disorder.
Yeah.
Testosterone, is one of the things, per all of our guidelines that we can utilize. But then there's things like Addy, which, improves your norepinephrine and dopamine in your brain. That gets you kind of excited. And 60% of women have a great response to it. And I love it. And I love it in my toolbox.
Yeah.
And even though it's not FDA approved for midlife women, the studies, show that it can be beneficial. So I give it as an offering. And the same with, Vyleesi, the injectable medication.
Yeah.
Bromolinitide that actually improves, your dopamine, and it's an as needed injection for low desire with distress. So,
And how does that work exactly? Is that like you come in, it's like a monthly thing you come in?
So that's just totally as needed. So if anything is like very similar to like popping a Viagra, this is probably because, with Addy, you have to take it every night. And after 2 to 3 months, we see if your neurochemistry has changed enough to improve your desire. And for the women that it works on, it improves desire, it improves arousal, and a lot of times it improves their orgasm. So it's all the way across the board, but it's approved for the use of low desire with bother. With Vyleesi, it's like analogous to this to melanocortins, which actually like then improve your dopamine. So you're getting a dopamine hit essentially. And so what we tell patients is at least 45 minutes before desired sexual activity, use this subcutaneous injection and see if you have any side effects, which can be like nausea, dizziness, headaches. And sometimes I'll give people anti-nausea medication in case. And the way I tell patients is like, if you're at home alone on a Friday night, get your favorite vibrator out, and try it on yourself before you try it, with a partner on date night, because
definitely. Definitely.
Yeah. And it lasts for like 12 or 13 hours. So some people they might not feel great to do it within the next hour, but maybe they have morning sex and it's great. And it's very similar. Like it gives you like this, surge of dopamine in a lot of patients. They feel amazing. They have great low desire, arousal, orgasm, and everything across the board.
Yeah.
And recently, and because of the way it works, some patients are like using it with their husbands too. Because like there was a small study that Dr. Irwin Goldstein did, and he showed at the AUA that this medication worked for men as well.
I was just listening to your interview with Irving and Sue, and they're my new neighbors here. Down south in La Jolla. And we were supposed to get together last year, and we both had conflicts with I think it was both of us had family coming in for the holidays. But, what they've done is so incredible. And they really are just like, so, as you call them, like just the OGs of women's sexual health. It was such a great interview, by the way. It was just, it was amazing and just full of amazing information. And so
I just love how he gets so excited about
so excited.
Yeah, and it's true. I just saw them in Rio, and like every week he's telling me something new they're doing. He's like, oh, what? We're doing this now, and I'm like, wait, let me take a note on this, and I'll try it with my patient.
Yeah,
he's the one that's like his group is really changing, and they teach us, right? Like they're presenting a big orgasm paper at ISWISH this year, which is the International Society for the Study of Women's Sexual Health, which is the society that he essentially formed with a bunch of his friends 25 years ago. And so I think that, it's pretty amazing, the stuff that he does and the new research that just continues to come out. It's awesome.
Yeah, so true. And I love their dream team, really dynamic that he and Sue have. And you were saying, tell me the Viagra story. And he was like, oh, Sue tells it better. And it's just, I just thought their passion is so inspiring. And I think that is something that, when you were on my podcast and we were talking about, what does it mean to have huge pussy energy? And I think as it applies to perimenopause, I think it really means to me, like, let's take all of this stuff that could be so like overwhelming and just like, oh my God, why is this happening to me? Now this, now that, now I'm screaming in the woods. I've got to add that to my list, whatever it is, right? I'm putting on 5,000 creams before I go to bed and now I can't sleep, right? Whatever it is, but taking it and actually making it fun. And seeing that silver lining in it and using it as a way that we can really come together. that's what excites me about this whole field. And just getting older.
Really, it's really just, movement of women just encouraging each other and trying to make life better for each other, I think.
Yes. Yes,
like,
exactly.
You have like advocates, you have like, life coach, you have all the people that are in this. And I think that all of their voices are so important.
It's true. It's really true. And so it's like, picking the thing that, if something is really bothering you, maybe it is your low libido, then starting with that, but then not loading all of it on at once, maybe just that one thing at a time, and then allow yourself to get successful at that thing, or allow yourself to see progress. Because I think that that's the other piece that, just kind of on the coaching side of things, it's important to look at is like, how do you define success?
Yeah.
Right. Yeah. So like, even with your patients is so key, because if success to me means like, hey, I slept in, or hey, I did the crossword puzzle, then, oh my God, right. Yeah. I'm doing great.
Yeah.
But that right there, that's the mindset shift. What I would refer to as huge pussy energy has got to come into this perimenopausal protocol, or your menopausal mindset, wherever you are, so we can really embrace it and be like, oh my God, like, look at what we're discovering.
Yeah.
All of these quote unquote failures that we've had, switch that into, now I know so much more. Now I can share that with other people. Yeah. I'm 49. Yeah. I have talked to my mom about her menopause experience, and she didn't stop bleeding until she was like 55 or 56. So I'm like, I'm in this for a minute, because we're really similar. Yeah. But lately I've had like the astronomical bleeding, and I'm like really embracing it. Like, I'm like, wow. Look at this. I'm like, this is impressive. Okay.
Look what your body can do. It's crazy.
Yeah. Like, I was on a plane back from London, and of course, like, that was the moment, like, where there's this one day where literally it's like, you've got to have in, I'm going to go with at least 2 tampons and just a lot of pads. And I was like, oh yeah, this is the moment where being on a plane is highly convenient. Yeah. But I chose to look at that as like, well, eat as much chocolate as you want, and then just be impressed with your heavy flow.
Yeah. Because then, like, you get the months where you're like, wait, it's 40 days and I haven't had my period.
Yeah.
Right? I wish I had that heavy flow today.
Thank you. That's exactly what I'm thinking about every time. I'm like, how many of these do you have left?
Yeah.
Right. So if you I can actually count that. So if I'm 55, right. If I am 55 and I'm like, you've got 60 of these left. 60 goes by really quickly when it's like months. Yeah. And I'm like, so just love it.
Really just knowing your body, and just being able to, like, then advocate for yourself and know what's going on for yourself. I feel those are very important things to do, just to make sure you have like a good quality of life, right? We're so limited in our world, and we don't know how much time we have on this planet.
No, we do not. No, we absolutely don't. We could
live our best
we
life.
could just kick it tomorrow. And therefore I really do believe at my core that, like, joy is our job. And we've got to approach this with huge pussy energy, so we can keep that as top of mind, because when we are miserable, does it do any good for our kids, or our people that we sleep with, or our people that we work with, or, anybody?
You're right, because that energy then just gets transferred to them. And then my husband says that all the time. He's like, sometimes when you're mad, like, the whole house is a little bit like off, right? But when you're laughing and having I notice it too, that I'm like, if I'm having a good time at home, like, everyone's having a good time at home.
Of course they are.
Yeah.
Of course they are. We're the tone setters. We are the tone setters. And I don't mean that just like as moms, or like the matriarch. I mean that just like, I feel like the people with the pussies are we are the tone setters. It's just that energy that we have, that we're like, this is happening. We are happy now. We are screaming in the woods now, everyone. This is what's happening.
Just as a side, what made me happy yesterday is I bought this little bitty karaoke. I saw this on Instagram. The little karaoke box. And so I just pulled it out, and my daughters and I started karaokeing in the middle of nowhere. it brought us the most joy. And I was
Oh my
like,
God.
this is cathartic. Maybe I should just be like karaoke night every 2 days.
That's a very huge pussy energy. Like that's really, it's joyful. It is contagious, right?
Yeah.
It's like,
And I can't
like,
sing. Like I'm tone deaf. So like
that
it was,
makes it more fun.
that makes it more fun.
That makes it more
Like
fun.
if someone's busting out a lyric, you're like, oh. But if someone's like just having a good time.
So in terms of your practice, you
Mm-hmm.
know, you are available but to women in the Chicago area, correct?
Yes. I'm actually I'm licensed in California, Indiana, Wisconsin, and Arizona. So I do have because I used to work in California, and I've gotten licenses in some in the Midwest. So I have seen some televisits, remotely for patients, strictly like for menopausal stuff. And sometimes they'll fly in to see me if we have like issues that need to be addressed from a physical perspective.
Yeah.
I do think that some of this stuff on perimenopause can be handled remotely, but that exam is kind of like one of these critical components. I feel like for us, the vulvovaginal exam, like taking a look down there, and making sure that the skin of the vulva is normal appearing. That we talk about how like in peri and postmenopause, the labia shrink away when you don't have estrogen and testosterone. And so these are the things that I think are important to look at, see what your clitoris looks like. Is it shrinking away?
True.
Are the adhesions really like there or not there? Is this the cause of your orgasm dysfunction? Some of these things need to be looked at. But I'm in Chicago, and I see patients, there, and I've done some virtual consults, and then I have friends in all these states too that I'm like, well, maybe you should get your vulva looked at. You need to see what's going on.
I wish everyone could see you. Like, I wish every single woman, you could be the doctor for every single woman in the world, right? Because right now we're not mandated to have like a sexual medicine specialist. We're not mandated to have like somebody that we talk to about our perimenopause or our hormones or our symptoms. We're just not. Like the protocol is go see your regular doctor every year and go get a mammogram and go get a
colonoscopy.
Thank you. And a pap smear. That's the one. That's the one that I'm always like, I don't want to.
Yeah.
But I just like,
after
I think it's the name too. I'm like, can we rename it? Can we rename it? Just anything.
I think it's named after this Papa Nikolai, who was the guy.
I don't like it. I think that's the smear. I don't like the word smear. Like, it's like, are we talking about
cells on something to look at?
Yeah. And like leave like schmear, right? Like for like on the bagel. Like let's leave that in the good place, not in like the
like a bagel. Yeah, it's like
bagel right. Like I'm like, I don't know. I don't know. I'm like, we need to rebrand the pap smear. Can we rebrand it, please? Could you talk to people about that? Could you get that done?
Okay, going on that.
I'm going to check in with you in a month and I want to see that that's done.
Okay.
I think that would be great. But the point of that is we don't have this like mandated, I'm going to go see my sexual medicine doctor. And I would love that. That to me would just be the best kind of huge pussy energy thing we could do for women is be like, yeah, this is what we do now. Oh, well, I talked to my, sexual medicine specialist and XYZ. Your podcast, I love so much. It's really fun. Like your energy in it is just really fun. Your topics, your guests are awesome. Oh my God, myself included now.
Yes,
I'm so excited.
Yours is being released tomorrow, but I don't know when this will be released. So then we don't know.
I'm excited to hear it because I was listening to your other ones and I was like, I love all of these. And then I was like, I'm going to be on here.
I'm going to be on there. Yeah.
Where else though can we get information like from you? People want to know more from you. They're not in Chicago, but they just want to. How can we just get as much of you as possible?
I have a YouTube video, Gyno Girl TV.
Okay.
I try to post on like topics like extended versions of like some of the stuff that we talk about.
Great.
I have the Instagram that I do, website. And I often am asked to comment from different sources and media. So that's something else.
But all Gyno Girl, right? Is that the main place? Just go to Gyno Girl. We can find you.
Behind Gyno Girl?
No, you didn't. Please do.
So I moved to LA like right after residency. That was my first job out as a full attending physician, where I was actually making money and actually doing the thing. So I was working at USC and. I had always dreamed of going to the Emmys because it was like, I love watching TV, movies, all the things. And, when you move to LA, you want to be in Hollywood, you want this Hollywood energy.
Totally.
So I somehow landed tickets to the Emmys like the first year that I moved there.
Mm-mm.
And it was around the time, do you remember Scrubs, the team Scrubs?
Oh, yeah.
Yeah, Scrubs. And so when I was a resident, like these guys were, residents on TV. So I saw my friend and I saw the Scrubs cast. And we they were so nice to us. We walked with them and started talking to them. And I was like, there was an episode they did about Gyno Girls, which were the gynecologists and they made it sound like they were sorority girls. Like, oh, here come the Gyno Girls. Yeah. And so I said to them, I was like, I'm an actual Gyno Girl. So none of them remembered my name. And like the Todd, who was like the surgical, the
Todd.
Do you remember him?
Yeah, totally.
He called me Gyno Girl a couple of times. And I was like, yeah, I'm Gyno. So then I rebranded it instead of like Gyno Girl, sorority girl, but Gyno Girl, the superhero that dispels myths, that smashes sexual stigmas. And because my husband and my kids are all big time we're all comic people.
Yeah.
So we're like Smallville addicts and all the things. So
I love it. Oh my God, what a great
Gyno
story.
Girl as opposed to Gyno Girl.
That's so good. And what a good show. That's a super fun show.
I love Scrubs. It was just, these little things that bring you enjoyment and during tough times in your life. I think, what you do and what all the actors, and I mean, they do a lot for us too. Like they oftentimes, it's like, sometimes it feels like you're saving them from people say this all the time when you hear them talk about Friends or these TV shows that have just carried for generations.
Yeah.
And why do you think it is the world gets so depressed when we lose those people? Is that they represent a time in our life and you can remember the joy you had in your life when you were watching those shows. Oh, I remember watching it with my friends from college and
Totally.
So it just
totally. You were a resident with Scrubs, and I felt like I went to high school with Beverly Hills 90210.
Yes.
They were seniors when I was a senior.
Yes.
And it was we're all graduating. All of us.
All of us.
I would like to make a pact to wrap up this show, which I feel like could go on 4 days because I could talk to you forever.
Yeah.
And that pact is, let's look into this rage thing.
I agree. Let's do it.
Right? I just feel like it deserves to have a place in our perimenopausal protocol.
Yeah.
I think that a rage ritual is necessary.
That is one of the most common things that people I just can't get over the fact that I'm just angry all the time.
Yeah.
I hear it every single day of my life in my office.
Yeah.
And I feel it every single day of my life at home.
Yeah, I like that a lot. I do. Yeah. I'm thinking also along with rebranding the pap smear, I'd like to rebrand the angry woman.
Yeah.
Because why can't the angry woman be just the hottest fucking bitch on the planet?
Yeah. Yeah. Bad bitch energy or something like that.
Yes. Yes. Mm-hmm. Oh my God, look at that angry woman,
I love it. I love it.
I'm Jacqueline Buckingham. Welcome to your most powerful chapter. Wherever you are on the pause spectrum, this is where you begin. Go to joinmeno.com and get early access. These are the answers, and we bring you the experts that have them.